We were sent a series of questions by viewer Lori W. about the COVID-19 vaccine. So we're getting the facts and answering her questions about the new vaccine. Our source is Dr. Payal Kohli, Yale Medicine, and the CDC. According to the CDC, the new COVID-19 vaccine targets a subvariant of the Omicron variant. The CDC says this should also work against other circulating variants. Lori W. wanted to know when should she and her husband get the vaccine because they want it to be most effective. Dr. Kohli says if you're waiting to get your shots until November or December, you should rethink that decision.
Your peak antibodies are about 2 to 4 weeks after you get boosted, but they don't just go away after those 4 weeks. You actually have a plateau.
If people want to time their shot perfectly for holiday travel, Dr. Kohli says now is the time to get your shot.
By Halloween, you'll have peak antibodies and you'll keep them through the Christmas time.
A study from Yale Medicine says the updated vaccines are not expected to prevent all cases of COVID. The aim is to reduce severe illness, hospitalization, and even death. According to the CDC, there was a surge in North Carolina COVID-19 hospitalizations at this time last year and in 2021, with most of the spikes happening around December. Lori W. also wanted to know how long the protection lasts. Dr. Kohli says after the initial spike in antibodies 2 to 4 weeks after you get boosted, you'll start to plateau. After about 4 months, you'll start to see a decrease in those antibodies. And if you're wondering what time of day you should get your vaccine, Dr. Kohli has an answer for that too.
So if you think about our immune system, it follows a circadian rhythm, and it's actually maximal when we're sleeping. So if you go in the afternoon to get your shot, that means that's really going to sort of kick in most when you're sleeping.
With your Verify Fact Check, I'm Meghan Bragg.
If you have something you would like verified, just email us at verify@wcnc.com.